Dr. Ashwin Vasan, and I am so grateful for you to be here, Dr. Vasan. And I want to welcome everybody and thank you for joining us and being part of the growing movement that is MAMA. Mothers Against Media Addiction is a grassroots movement of parents, grandparents, educators, and other allies who are fighting back against media addiction in kids and teens and creating a world where real-life experiences and interaction remain at the heart of a healthy childhood. Despite some arguments you may hear that there isn't evidence smartphones and social media are causing the problems in youth mental health, there is an abundance of evidence that real life experiences and interaction, real life human to human hugging, being present, and giving full, undistracted attention to children and peers provides the best foundation to grow up healthy and stay healthy as adults. My esteemed guest tonight is one of the nation's leading public health officials, the Commissioner of the New York City Department of Health and Mental Hygiene. Dr. Vasan is a primary care physician, epidemiologist, and public health expert with nearly 20 years of experience working to improve physical and mental health, social welfare, and public policy. Since 2014, he served on the faculty of the Columbia University Mailman School of Public Health and the Vagelos College of Physicians and Surgeons. He also somehow continues to see patients as a primary care internist in the Division of General Medicine at New York Presbyterian Hospital, Columbia University Irving Medical Center. And Dr. Vasan's incredible training, no doubt, brought him to his position. He's earned a BA in economics from UCLA. I believe he has a Master's of Science in Epidemiology from Harvard School of Public Health. He earned an MD from the University of Michigan and his PhD in public health from the London School of Hygiene and Tropical Medicine. He has published many, many articles. He holds many other titles, but if I go on tonight, we'll never get started. So Dr. Vasan, thank you so much for being here with us tonight.
Oh, it's wonderful to be here. I remember meeting you more than 18 months ago, 2 years ago almost, and how passionate you were about this issue, Julie, and to see this grow into an organization and now a movement that's growing, it gives me a lot of pride to see that we're all coming together to really fight for our kids. And obviously, it has a lot of allusions to what we all grew up in, Mothers Against Drunk Driving and MAD, and how powerful that movement was to raise awareness. And you guys are just doing a great job, and you're just getting started. So glad to be here and glad to be speaking with you.
Well, thank you so much for that. I've been a journalist for many years and I never considered myself a health reporter, but I learned about you when you published an op-ed calling social media a quote unquote toxin. Why did you use that word?
Well, very intentionally so. Um, Obviously, I'm the commissioner of the largest public health system in the country, the largest local public health system in the country, city public health system in the country. We spend more on public health in New York City than per capita than any other place in the country, and we have the largest and probably the most talented public health department in the country, even standing aside the CDC. And so, with that proud tradition, you walk into a job like this and you say, what are the problems of the day? And what are the tools I have to use? And for me, um, social media and the unregulated social media, as we've called it, because it's not everything, it's not all of it. It's really the fact that this is an unfettered, unregulated exposure, really is a public health exposure. And so we said to ourselves, what are the tools of public health that we can bring to bear? And there are many, many allusions to the things that we do in environmental health to control physical toxins or environmental toxins. And that includes things like harm reduction, awareness raising, of course, robust research and evaluation of impact, but it also includes controls and mitigation and, when needed, legislation and regulation. And sometimes you even have to use the tools of the law to get it, right? The tools of the justice system to get it. And so for all of those reasons, we have a long history of doing that with environmental exposures, with tobacco. So I said, let's try to do this using our tools here in New York City, building on that long tradition.
Well, it was a relief for those of us who knew that we needed to make some change to keep kids safe, And in January of this year, you followed in the footsteps of the US Surgeon General and did something I believe no other health commissioner of any city has done. You declared social media a public health threat and actually issued an advisory. On what basis did you determine social media is a public health threat?
Well, it's clear in our data that our kids are hurting. We're seeing rates of hopelessness, sadness, of course, clinical depression, anxiety, self-reported self-harm, reports of self-harm, reports of suicidal thoughts, and of course, suicides in particular groups like teen girls, LGBTQ and trans children, and teens. Those are rates that are all increasing across the nation, and in New York City. And when we look at the obviously we've been through the pandemic and a time of social isolation and dislocation. Um, but when you look at the data, this started in and around the time that social media platforms became ubiquitous on handheld devices and mobile devices, 2011, 2012, so forth. And so that to me represents a trend, an epidemic, something that is out of proportion of norm, and something then that requires us to define it as such and requires us to raise the alarm. And these commissioners' advisories or surgeon general's advisories are all about, number one, raising the alarm from grounded in data and science and grounded in the public health authority that we have, and two, to give some clear guidance to people about what they can do about it. And so within that advisory that we issued um, in early 2023, we said very clearly parents should delay initiation of social media until at least age 14, at which time they should reassess the child, reassess the data, which hopefully has improved, and then make a sound choice. We also advocated, like the Surgeon General, for tech-free times, or he calls them tech-free zones. Um, and so this is actually good government at work, right? The federal level making proclamations and advisories, and then local levels and states seeing what can we do in our sandbox to bring that to life. And so that was the main reason. But it was like with all public health advisories, it's grounded in data, it's grounded in the science, and it's grounded in epidemiological trends that say at a population level, our kids are hurting. It's showing up in our lives every day, but it's showing up in our emergency rooms and our healthcare systems and in our communities. And now's the time for us. It's the first stake in the ground
First
for
take,
us to start
yeah.
a coordinated effort to make it better.
One of the items in your advisories was, as you said, that parents delay the use of devices until age 14. Parents frequently ask me about what age is safe for their kids to get a smartphone. And I say the same thing that you said in your advisory, that there really is no safe age, because at the current moment, there is nothing really regulating social media. So children can be served all kinds of content, including self-harm advice, suicidal, depressive kind of information, eating disorder content. You also made a point in the advisory of talking about the child development that happens between age 8 and 14. What do we know about that stage of a child's growth?
Well, it's an extraordinarily vulnerable time. It's a time of great and rapid brain development, number one, but also social and emotional development, identity formation, perceptions of risk and risk taking, social networking. And so bombarding a young developing brain like that with images, with content, with unfettered, unregulated content, some of which can be deeply harmful, whether it's bullying or body image or violent or otherwise, or sexual in nature. This is not appropriate for a developing brain. And so that, now it's not to say that all 14-year-olds are the same. It's not to say that um, 14-year-old brains are done developing, but in terms of this crucial and highly vulnerable time. And it's also a time where children are actually forming relationships and forming the practice of developing relationships for the rest of their lives. How you relate to others between 8 and 14 is very powerful in shaping how you'll relate to others the rest of your life. And if you're not actually relating to others and you're spending your time on screens, or you're relating to people through these devices, that too will have long-term impacts, which is why um, the American Academy of Pediatrics, American Academy of Family Physicians agree that this is an incredibly vulnerable time for developing brains in adolescents, and so we shouldn't be exposing them to a totally uncontrolled thing like social media.
Another part of your advisory was asking parents to look at their own use of devices and what we model with smartphones in front of our kids. This is a tough one. I'm on my smartphone in front of my children far more than I would like. And I admit that overcoming media addiction is often about making a choice, sort of whether to go ahead and answer one more email for work, check out something fun I wanted to check out, or whether to be fully present with my friends or family. You have 3 kids, and I know you are working after hours. How do you manage this?
Not well sometimes, but improving and trying. And I want to say this, the Surgeon General issued his advisory in, I think, May 2023. And we were already in the midst of launching a convening of national leaders and young people themselves. We did it on a day off from school here in New York City in June of 2023, something that we signaled our intent to do when we released our mental health plan in March 2023. So it was really, we weren't coordinating. It was
Mm.
just kismet in terms of timing. But in that convening at Rockefeller Foundation, we had young people, young leaders, youth leaders, teenagers there who said very clearly, number one, we need help. We need the adults to be adults. Number two, we don't want punishment. We want conversation and dialogue. But number three, to this point, we want better role models. We don't take you seriously if you are lecturing us about social media when you're at the dinner table looking at your phones, or where we don't feel like we have your attention. So it starts with us. You asked about me. My 11-year-old calls me out all the time. And what I try to do is say, A, apologize, B, put the phone down, C, really do find those times in the day, dinner time when I get home from work, whatever time that is. When I'm done here, I'm going to go sit with them without my phone, bedtime, morning times, and just show them that I'm not on my phone. Just show them what it looks like and what it feels like. Admittedly, it's really hard. It's really hard because the moment I'm out the door, or the moment I'm dropping them off at school, I'm on it, and I'm in the mainframe in my device pretty much all day. And so we've got to find better ways to not only make those transitions, but to figure out how to modulate that at work as well. Because it isn't realistic to expect adults to be plugged in all day and then just to be able to shift it off, because it's addictive for us too.
I mean, there is, I believe it was Australia that they actually passed a law forbidding employers to email workers after hours because it's such an intrusion. And, we're called Mothers Against Media Addiction because it's our whole society. We're addicted to screens. We have screens in our restaurants and our elevators, they're everywhere. So one part of your advisory said adults who interact with children and youth, including caregivers, healthcare providers, educators, and school staff, community-based organizations, and youth development staff should take opportunities to promote social media in a manner that's protective of mental health, which includes implementing tech-free times and places in relevant settings that encourage in-person connection. Why is in-person connection so important in a health sense?
Well, on an evolutionary basis, that is what we are. We are socially networked creatures that need one another and that feed off one another. And we can see that in our behavior. We can see that in our physical health. When you're around other people, at least some other people, blood pressure goes down, stress levels goes down, cortisol levels go down, especially in communities you feel supported in. We see that healthy neurotransmitter levels become regulated and stabilized. You asked about also what we know about neurodevelopment. Now the research is becoming clearer that time on screens and time on social media, in particular rapid video content, is increasing levels of dopamine, serotonin, GABA, norepinephrine, big neurotransmitters in your brain that are all associated with different types of addiction. All of them are elevated at once. And so being around other human beings, taking away that kind of addicted rapid fire interaction also lowers the level of those neurotransmitters. So it is good for the health. It's also good for your mental health, of course, right? And the feeling of social connection, the feeling of social support, the feeling, the antidote to loneliness and isolation. So for all of those reasons, this is both a physical and mental health necessity for us. And evolutionarily, we are atomizing ourselves to such a degree with these screens that I think this is why we're starting to see these societal fractures become wider. Why our discourse is becoming more and more divisive and polarized. Why our attention spans, of course, are becoming shorter and shorter. So we have to get back to that connection. And while we as adults might be too far gone to fundamentally change, we can do better for our kids. And you mentioned all those different organizations. What we wanted to do following on this advisory was to say, what is the guidance that we can provide to teachers, parents, young people themselves, and youth serving organizations to help them start conversations? Because the thing we heard also at this convening, and that I've heard in my own social groups, like many of you, is that this is so hard to talk about. There's so much shame, particularly for parents, in how their ability to regulate or not regulate their child's social media use is associated with perceptions of good or bad parenting. And we need to make people feel that we're not alone and also provide them guidance on even how to have those conversations. So we followed the advisory with actual guidelines for those different stakeholders and how to have those conversations. And so that's available online as well on our social on the nyc.gov health/social media website.
That's great. The idea of providing these tech-free times and places brings me to schools. Mama advocates for phone-free schools because we know that those in-person experiences provide the fundamental building blocks of social, emotional, and mental health. Is there anything you want to say about the New York City school situation? I know there was a hope to get phones banned this fall. There's a delay. Any
Yeah,
update?
and look, I think that hope still remains, right? I I'm I've been advocating for this internally for the better part of a year. Folks have come along now and landed in the right place. But I understand we've had a history with this, and this is the largest and most complex school system in the country, perhaps the world. And so we want to get it right. And if we can do a year of rigorous study, which is what the Department of Health will be leading with the New York City Public Schools, and we can learn how best to sustain these changes, how best to not just leave principals and administrators dangling and children themselves, students themselves, how best to get it right and how we can phase it in. I think it's not the worst outcome to take that time and to get it right and to publish research and to show that, as we know from settings all across this world, that phone-free schools improve academic outcomes, behavioral outcomes, disciplinary outcomes, mental health outcomes, attendance, right? So
All the things.
all the things you want out of great education for our kids. So, as much as I too wanted to push it through this year, big things like this don't get pushed through, and so I understand completely why the mayor and chancellor have taken this approach. It's easy for me to say; I don't have to be out there implementing it and day to day, and so I think
Schools
we'll
all
get
over
there.
the country are struggling with the best way to
Yeah,
implement
and
it.
I think we'll get there, right? LA Unified School District did it. Now they're kind of struggling with implementation. We will get there. I'm quite convinced. I know that the mayor wants to get there, the chancellor wants to get there. I certainly have been loud and proud about wanting to get there, but I understand why the deliberate approach may be taken in this instance. As much as I'm always a fan of the bold approach, but this a little bit of deliberation, particularly in a city where we've reversed a school ban once, is probably a fair outcome for now.
So your advisory didn't expressly mention infants or toddlers, but when I walk down the street and see toddlers in their strollers watching tablets or phones that have been clipped to the strollers themselves, my alarm bells start to go off. Is there anything you want to say about the importance of early childhood development and screens?
Well, I mean, the WHO has said very clearly that early exposure to screens below age 2 is not healthy. not good for brain development. They also say, and so does the American Academy of Pediatrics says very clearly that if you have to show a child a screen below age 2 or between ages 2 and 5, try to make it not only limited, but things like FaceTime and interacting with a real person versus passive viewing of television or certainly social media content would be a no. So, uh, this, I think this Jonathan Haidt and others get this right. We have not only are we addicted to these screens and to the media on them, but it's become such a social crutch and a parenting crutch and a childcare crutch, and that's a shame. It's a real shame, and I hope that we can find a balance back between how we actually take care of our kids. And I want to be mindful that childcare is getting harder and harder, more expensive. Parenting is getting more stressful. The Surgeon General issued another advisory on parental stress recently. I think that's directionally correct. So we're not parenting in the same times, but and so we do have to address those structural supports for the care economy and for parents. But um, in the meantime, using these devices as crutches for our stress or for our caregiving is not good for our young people, not good for our kids. So we've got to really raise some awareness about it and give people the tools to find alternatives. Really tough problem.
It's a really tough
And
problem, and we're trying to raise awareness of it too.
yeah,
Um,
yeah, and the habits are formed really, really early.
really
I
early.
see it in my kids. My kids are 11, 8, and 5, and my 5-year-old has taken his cues from my 8 and my 11 about their use of screens. But the good news is, I mean, kids. My daughter, my 11-year-old, didn't have access to screens in her early development, but as I had more children, screens became more and more a part of their earlier and earlier part of their life, and um, you know, you can see them taking on the features of that.
I have said this before in other expert insight series conversations, but my kids are a little older than yours. And when my first son was born, there were no iPhones, and Mark Zuckerberg worked at a small company called the Facebook. And my second son, by the time he was in pre-K, every parent in the neighborhood had a smartphone and was inadvertently training their child that that was normal to be photographed constantly. Whereas with my oldest, we only took out the camera for special occasions. And now my youngest son, who just started high school, is growing up in a world of TikTok, which he's not allowed to have, but his friends still send them to him. And these other platforms
Yeah.
are going shorter to shorter reels. So
Yep.
it is, the overall environment. And to that extent, your office took another extraordinary step in February of this year by suing 5 social media companies along with the city of New York. Many families whose children have been harmed because of explicit decisions in these algorithms are also suing social media. Can you explain why it was appropriate from a public health perspective to take that course of action and why parents should pay attention to that?
Yeah. I mean, as I opened up, sometimes in public health, you have to use the tools of the law and the legal system, the justice system, to get the kind of controls and regulation that you need. Um, when we had the national highway system built in the 60s and cars got bigger and car accidents went up and people started dying. And then the National Highway Transportation Safety Act was passed through a lot of um, threat of litigation, but also a lot of advocacy on the car companies. Um, and seatbelts were passed. And so we are saying very clearly we need safer social media now. We're not saying get rid of it and put it in the trash bin, because I don't know that that's realistic for our life, our economy, or anything else. But it needs to be fundamentally safer. And so they're not going to do it by asking nicely. They're not going to do it by, and every single company, I met with all of them, will come to you and say, look at our wonderful controls, look at our wonderful protections, don't sue us, or think about what you're doing. But we didn't ask the auto companies to design their own seatbelts. We didn't say, give your bespoke version of a harness. No, we said, this is a seatbelt, put it in your cars. We're going to check if it's up to standard. And that's what we need from the federal government. And that's what we need from these companies, and we have to demand it. And so this lawsuit was a little bit different than a lot of the other lawsuits out there. There are hundreds, obviously, from local jurisdictions, states, and otherwise. But we're the only health department, we're the only public health system, if you include our safety net hospital system as well. We're the only public health system to sue on this basis of real mental health impact. And we modeled a cost estimate of what the impact on our health system is of youth mental health crises, suicide attempts, depression
What
treatment,
is that
anxiety treatment.
figure? I'm curious.
And it's over $100 million a year. And so, as a starting point, right, just to give a sense. And of course, we had the Department of Education, we had others who were part of the suit. The law department, of course, leads these suits, but we were the only jurisdiction in the country to sue on the basis of public health. So that, I think, was an important message to send. Now the suit gets wrapped up in other suits, and there are two buckets of suits, as you know. There's these local suits, which are now part of the federal multi-district litigation, which is based in the Northern District of California, where the companies are based. And then there's the attorneys general suits, 33 attorneys general that have sued as well. So it's moving its way through. It's obviously getting a ton of legal challenges, but I think it was an important message to send, and I hope it sends a signal, another signal, that we're demanding change, and we will. If you don't give it, we will take it.
The discourse around it is really interesting to me. A columnist in the New York Post called that lawsuit lunatic, or maybe he called you lunatic. I'm not sure. But
Wouldn't be surprised.
he said that the city shouldn't be suing because, quote, the real estate related taxes that those companies pay are the golden goose to the city treasury. And it's indeed true that social media companies make lots of money. According to a report this past Friday in Bloomberg, Mark Zuckerberg's personal wealth has gone up $55 billion since the start of 2024. And I like money, I swear. I like going out to eat. I like having a nice home. But somehow I just don't see how it's acceptable for social media companies or cities or anyone to make so much money on the backs of young children's health. I mean, is that a fair assessment, or is my anger displaced?
Anger aside, I think we know these tech companies are a part of our lives. And one of the things we did, is to say to each of them, we sat them down individually and as a group and said, look, the city of New York is a tech friendly city. We want tech development. We want advanced AI. We want advanced industry on the basis of leading edge technology, but you're not doing right in this area. And so friends can both argue on one hand and also cooperate on others. And so these are huge companies, and I don't think it's wise to use their size or their influence as a reason not to hold them to account. And someone needs to hold them to account. And right now it doesn't appear that that's coming, although there's positive directional motion in Washington. And so we said to ourselves, what can we do? What can we do at a local level? All of these things, whether it's the public health advisories, the lawsuit, the research, the education, all of it. We said we have a responsibility to do the maximum of what we can do within our span of control. And what we can't control is up to the states, and frankly, it's up to the federal government, because this isn't a controlled exposure. Unlike a Superfund site or an environmental release of a toxin, there's no confined area here. This is like the wildfire smoke that you saw last summer, 2 summers ago, right? Which just descended on our city and was everywhere, descended on the whole eastern seaboard. That's what social media is like. It's everywhere.
It's
And so
everywhere, right?
it
Yeah.
really is something that the federal government and frankly international bodies as well need to come in and get their hands around.
Yeah, and I mean, I can't say enough how frustrating it is that the federal government hasn't acted. The last meaningful legislation was back in 1998 when we were all dialing up AOL from our landlines. There is some forward motion, as you said. The Senate recently passed by a 91 vote, 91 yeses, tripartisan, which is remarkable, to approve what's now called CASPA, a combination of the Kids Online Safety Act and the Child Online Privacy Protection Act update. It's going over to the House. I think we're going to start seeing some people pushing very hard for the House to act on this sooner rather than later. But I guess, it's makes a lot of sense why states and cities have stepped up to try and do something, because waiting so long, means more deaths. So in a moment, I'm actually going to open up the audience questions. If anyone has a question, you're welcome to put it in the Q&A. But before I do, I wanted to ask you about a couple more things, including drug deaths and how they've spiked nationwide. According to the UCLA, an average of 22 adolescents 14 to 18 years of age are now dying in the US each week from drug overdoses. Excuse me, that actually is from 2022, which means the rate is even higher now. And that's driven largely by fentanyl and counterfeit pills. So these adolescent deaths are equal to basically a high school classroom of teenagers dying each week. And they are the third largest cause of death behind firearm related injuries and vehicle collisions. So how does social media play a role in the fentanyl crisis? Can you speak to that a little bit?
Yeah, and it is indeed a crisis. Fentanyl has completely changed the game on the opioid crisis and the overdose crisis. It's put us all in public health and government and public safety behind the eight ball because we can't keep up. It's flowing across our border, and the way that it's coming in, it looks like anything else, and it can be anywhere. It's so extraordinarily dangerous, which is why we've taken a lot of steps to raise awareness about it. But we have to get ahead of this, and we don't necessarily have all the tools to do so. At the root of it, though, is mental health, because when you talk to any person who uses substances for any longer period of time, there's a gain, right? A secondary gain. They're using it to treat some other untreated pain, whether it be physical pain or more often than not, emotional and mental health pain. And so we've got to get to the root of our mental health crisis by getting our kids the help that they need, which is a major focus of ours here. But you talked about the role of these platforms in exacerbating the crisis. Well, I like to call them the misinformation superhighway. And when you have no controls, when you have a refusal to do content moderation, when you have a refusal to take any responsibility for the information on any of these platforms by the companies, then we are seeing a growing trend of drug related content, encouraging young people to use, and ignoring completely the safety concerns and the health concerns, the public health concerns, and overlooking, or downplaying the risks of fentanyl. And so we really are, in the same way that during COVID we established a misinformation unit at the health department to target where vaccine misinformation is where it's going in the city in order to get people vaccinated and to target our counter messaging. The same is true for things like overdose. We are seeing very targeted messaging, and no surprise, a lot of that messaging is going to low income communities and communities of color where those risks are being downplayed. So all of that is to say, it is a real issue. We are paying attention to it, and everyone is struggling to find the answers. I will say, going upstream and treating youth mental health is a start, and an important start.
I have met parents whose children have died because they purchased
Yeah.
pills on Snapchat that they believed were something else. And those parents don't like to refer to those deaths as overdoses. They call them murders because their child wasn't looking to consume
I
something
mean,
like.
our former chief information officer at the health department under Mayor Bloomberg has been very public about the loss of his son, um, who was graduating from college and died celebrating his graduation and wasn't intending to use anything like it. And so this hits all of us. This hits home for every community, and no one's left untouched. And this is what makes this crisis, fentanyl and opioids, so much more powerful than any other drug crisis we've seen, because we're seeing it cross lines. We're seeing it cross racial, social, economic lines in ways that should force us to respond collectively. And that's why I issued an order, not only declaring it a crisis once again, but also asking every New Yorker to carry naloxone, and encouraging them. Not we give out hundreds of thousands of doses for free a year, but now any New Yorker can go to any American can go to a pharmacy and buy it for $45, thanks to the administration making that so. And so we've got to be a part of the solution, and naloxone has to be everywhere, in the same way that epinephrine and AEDs are everywhere they need to be. And that's one part of the solution, but it's extraordinarily tough problem.
It is a tough problem, and fighting media addiction is a tough problem. We're living in a consumer culture where, billions are spent advertising new products. The tech industry is constantly hyping the need for the latest, the greatest, whatever is next. At Mama, we try and say that technology can be fun, it can be helpful, but it's not always the best solution. And one thing I wanted to ask you about was New York City's decision to spend $26 million on Talkspace, which is a free online counseling and therapy service to New York City teenagers. I know, even though tech isn't always the best solution, that some young people don't have access to in-person therapy. They don't have a parent who will take them somewhere. I know there's a shortage of trained counselors. So how do you think about balancing tech solutions to public health problems, but not trying to over promote technology as a solution, is always the right solution?
Yeah, and looking at my career, I've never been some sort of technology evangelist. Um, I'm a people person and a people first person. I want robust health workforces, public health workforces to be there. We just don't have it anywhere in America. We have such a deficit of social workers, of psychotherapists, of psychiatrists, and then take ones that actually know how to treat young people, child psychiatrists and psychologists. It is entirely a deficit. And you attach that to payment rules, which incentivize, and there's been great reporting on this recently on ProPublica, that incentivize providers to leave insurance systems, and it results in massive amounts of unmet need, and even greater amounts for kids of color, for low income kids, and for um, ethnic and minority kids whose English is their second language. It is extraordinarily tough to get mental health care. And so we balance this very real concern about, working with off the shelf products and working with tech companies. We approach this very deliberately with a very real concern that kids are hurting, and the cost of inaction and the cost of hemming and hawing and playing Monday morning quarterback about this company or that company. Meanwhile, our kids are not getting the help they need. And what validates this, helps me sleep at night, is the fact that we're not even a year into it, and 16,000 New Yorkers aged 13 to 17 have signed up for therapy. 67% say they've experienced relief. 60% are BIPOC kids, and the majority are from our TREE neighborhoods, the Task Force on Racial Inclusion and Equity neighborhoods that were hardest hit during COVID. So I defy anyone to tell me that that's not a good thing for our kids. Now, with all of that, I'm very mindful of concerns like privacy concerns and data concerns. And we did a huge comparative analysis of different companies in this pilot. It's a pilot, right? It's a demonstration project. And we've put in extra protections on top of the basic HIPAA protections for the data that's inputted into the platform. Data is destroyed after 30 days. And so, I defy anyone to say that we're not trying to take care of our kids and their data, in order to get them access to, frankly, life-saving therapy. So I want to see tech work for good. I think the private sector has a huge role to play in the future of mental health care in particular. because the public sector, we have been so structurally underfunded for so many years because we have criminalized mental health, we've institutionalized mental health, but we've never really invested in community mental health. That's going to take a generation or more to rebuild. So tech does have a role to play. Now, how government works with tech, manages tech, and all of the different conflicts and considerations is a really important set of questions. I have to say, Talkspace has been a very good partner in this.
That's great. So I want to invite the audience to put any questions you might have into the chat. Otherwise, I'm going to let us wrap up a little bit early tonight so that Dr. Vasan and I can both get back to our families. But before we finish, I guess I wanted to ask you about like you, I'm a parent of three, and I just feel the pain of trying to raise my kids in a media addicted society where there are supercomputers everywhere in our pockets. Like maybe we should stop calling them phones. We should just call them mini supercomputers. And, what do you think parents should be doing right now to address this sort of tectonic shift in our society? What is the best thing for parents to do?
Well, one thing is what we're doing today. You got to talk about it. We got to break past the stigma, the shame. We're all in this together. We're all struggling. I've yet to meet a parent who's nailing it in New York City. Okay, you want to go live in rural New York or wherever you live and not have access to the internet, that's fine. God bless you. But here in our city and cities like it all across this country and this world, everyone is struggling. And so a little bit of grace and a little bit of empathy for oneself and each other is a great place to start because it gives us a basis for dialogue. And ultimately, we're going to have to talk about this. We're going to have to talk about it in the context of our parenting models, our cultural models, how we superimpose those things. I think that's one of the hardest things for me as an Asian American dad, as an Indian dad, is my sort of Asianness coming into all of this and my sense of shame and as a parent and what am I doing wrong for my kids, right? And that is a huge cultural touch point for me, in addition to just a regular old parenting issue. We got to talk about it and we have to form community around it and we have to try to work our way through it together and support one another. Number one. Number two, I think we need to spend more time together and our kids need to spend more time together and less time on these screens. And number three, as we started with, we've got to work on our own practice. We've got to work on our own, one of the one of the more ironic critiques we've had of many, we get critiqued a lot as we should in government, is launching a digital mental health initiative at a time when you're saying spend less time on devices. I get the irony, right? And I get the irony that we're here on Zoom talking about this, right? So we understand this is a part of our lives, but we can work on modulating and modifying and modeling better behavior every single day in little ways. And so I think that's the best advice I have because I'm about to go upstairs and fight with my 11-year-old about what she's doing. Has she finished her homework? And does she get her 20 or 30 minutes of screen time? And what is it? Right. I mean, she doesn't get
Yeah,
social media, but
I always encourage parents just to sit with their child and look at it because
yeah.
sometimes you're surprised to see. Dr. Vasan, we have a question about how do you advise supporting our young adults who are 19 to 25 who have been diagnosed with anxiety and have so much difficulty having face-to-face relationships after growing up on screens?
Yeah, and this is where higher education plays a huge role. Colleges and universities are making big investments. CUNY has actually made pretty incredible investments into college mental health programs, counseling programs. But I also think that um, how we talk to our kids about their media use is really important. You know, and I've taken some shifts in this in my own life. I used to think everything my daughter watches is stupid, and so I said, "Why are you watching this stupid thing?" That is not the basis for a positive discussion, right? You have to show genuine interest in what they're interested in, and the same goes for a 19 or 20-year-old. What are they actually interested in? And particularly at a time when you may be finishing college or you're in college, thinking about your next step, your career, grad school, whatever it is, wherever your life is headed. You have to show interest in them as people. And they then, like any, I know it sounds like common sense, but it's really true. We have to show interest in them, and then they'll open up to us about what they use media for and why they use it. Are they using it to escape? Are they using it to make themselves feel better and to treat some sort of pain? Are they using it to create? And that is a real thing. My daughter spends a lot of time drawing and on her tablet, right? So are they using it to create? Are they using it to create art and music? These are all things that our generation that didn't grow up with these devices or these platforms, we need to get smarter about and better at working with our young people, regardless of age, but particularly the older kids.
That is such good parenting advice, not only medical advice. And I cannot thank you enough for your time tonight and for the way you have stood up for our kids and, to do something when our federal government has kind of, you know, had some dysfunction, let's say. I'm trying to let you go early, but more questions are coming in.
Yeah, no, I'm
Um,
happy to. I'm happy to.
Another
I have
one,
till 8, so
okay,
I'm
my
good.
25-year-old admits to being addicted and has removed the app several times, but it also can be her source of connection. What do you do in that case? And, we hear that also with young boys now, they connect over video games, and parents want their children to connect, but the video game part of it is not necessarily safe because we know that those chats are not moderated and that strange adults can contact children.
Yeah, there's a lot of risk, and I think that um, one thing is we need to create time, spaces, and opportunities for kids to reconnect in person, and that means slowing down a bit, doing a little bit less, and carving out an extra hour on the weekends or extra 2 hours on the weekends to actually have a play date and to push. Right? It is so hard to keep and maintain friendships as adults now because we're so overprogrammed. you know, we are all aware of yeah, let's circle back on that text that we get, right? And then you don't hear from the person for 6 months. And that's become de rigueur for parents of our age and our generation. And that's not okay, right? So how we deal with our friends is going to be the way that they deal with their friends. One of the things that I try to do is surround myself with the people closest to me a lot in front of my kids. And now our kids are friends, and to do so in a way that has nothing to do with my work or nothing to do with who I am professionally. And that's a really good modeling exercise for my kids in the face of all this, the whatever else they're bombarded with. And they're still young. They're at the beginning stages of being bombarded, unlike yours are a little older. So I don't have a great answer other than to say it is the intentionality and the way in which we make space for other human beings to connect in person in real life that really goes a long way. And it doesn't take much, right? You do that an hour a week, 2 hours a week on the weekends, whatever you can carve into your time, it matters. It really, really matters. And you will see, I've seen it in my own life, that they crave that. It becomes a virtuous cycle. They start asking for that time. And so you start somewhere. Start somewhere. Don't feel like you have to boil the ocean. Just start somewhere.
I mean, almost a decade ago, a son of a teacher of one of my sons said that he wasn't really reading and wasn't really interested in books. And my husband and I realized that we read all the time, but we were reading on our phones and they never saw us with magazines and with books. And we instituted a family reading hour on Sundays where we all curled up together in front of the fireplace, made popcorn, and you had to have a book or a magazine or a graphic novel, something to hold in your hands. And at first they complained like crazy, but after a few weeks, it kind of became this beloved tradition. And, it only lasted a year or two, but I swear that small intervention like changed the shape of his academic career. And I don't, if we hadn't done that, I don't know if he would have become the student that he is now. And so I think a lot of times parents forget that sometimes it doesn't take that much, but those small shifts, inviting the neighbors over for a barbecue, that can have a profound effect.
Yeah, and we live in a world, and I'll get off my soapbox on this because this isn't squarely in the medical advice category. But as a parent, and as a parent in this time, we too are bombarded with this notion of like, what's the right way to do things? There's a heuristic for this kind of parenting, helicopter parenting, this kind of parenting, keeping your kids safe parenting, culturally appropriate parenting. It's just parenting, and you can try things, right? It's a long-term experiment, and we just keep trying new things. And sometimes I feel it in myself, and I know that my peers feel it too, is that the fear of experimentation has gone too high, right? We're afraid to try new things, and sometimes it really works, and not all of it works, and we have to be prepared to also fail and fail forward. But we've become so risk averse. I mean, there are real risks, right? There are real risks online. There's real risks in the world, but our risk assessment has become so kind of scattered. I think as parents, we have become very risk averse, even for small things, small tests of change, as we like to say in management. So I don't know. I mean, I do think these things you described are lovely, lovely examples of how you can just do these small tweaks. So during the pandemic, we went for a hike just about every week, somewhere, right? And we got in the car, packed in the whole 12 months, and that for 1 year, for a good year, maybe even a little more.
Your
And it
kids
was,
will always remember that.
and they'll always remember that. And now we don't do it. Now we just don't have the time, and we have a third kid, but we did it, and that mattered. And so just because you don't continue to do it doesn't mean it didn't matter.
A audience member offered this idea too, which I love. It says having diverse groups of folks over to your house. Just invite over different looking folks, their kids, open up with their kids, and it creates connections. I mean, we've done that where we've just invited a bunch of new neighbors that we didn't know and said, come on over. And, it ends up breeding warmth in the neighborhood. The kids recognize each other. It just creates connections and gives, the kids a real sense of attachment to their community. And that helps, right? Because parenting isn't easy. So, um,
Yeah.
last question for you. Someone wants to know about Meta making a new announcement that they're going to do something about taking down self-harm content. How do we balance sort of partnering with them to do this kind of work versus taking the position of, insisting that they do it? I mean, I see things the way you do, that, we don't ask corporations to keep our baby formulas safe. Our government says we need to make sure we have a safe food supply. We don't ask automobile manufacturers to put some kind of safety mechanism in the car. We insist they put in seatbelts. I mean, do you think we should be partnering with these groups, whether it's a nonprofit or the government? What role do you think each of these types of organizations should play?
I think that they would certainly like it this way, this sort of fragmented institutional way, because it fundamentally lets them off the hook in some way. Look, bottom line is they're not going to do anything that hurts their bottom line, and we know that targeted ads to children makes them about just that. Targeted ads to minors, right, just makes them about $1 billion a year, just that. So they're not going to do anything fundamentally to reduce the screen time of anyone, because eyeballs and time on task, time on content, time on screen is money. And so I'm all for content moderation. I'm glad that Meta's talking about it. Ultimately, we need to demand it and create a standard. COSA is a great start. It's not a perfect law. It's a start, because it creates that duty of care. It creates privacy. It builds on COPA with the privacy standards and enhancing privacy standards. It is a floor of regulation. It's not the ceiling. And like I give some credit to the folks at Pinterest who have been out. Bill Reedy's been out on this issue. I've been on panels with him. He says he wants to be the Volvo of social media platforms. Volvo and Subaru, they go above and beyond, but they do what the government says, and then they innovate in safety because safety is their brand. Okay, but without that floor that comes in with regulation, I just don't see how that's a sustainable model. And frankly, it puts more onus on us as parents and on young people to figure this patchwork system out. We need safer social media in the same way that we needed safer cars. We didn't say go figure out which seatbelt works for you and pick it.
Right.
That doesn't
Yeah,
it
we
doesn't
need
make
safe.
sense.
I agree. We need safer social media. We also need safer devices. And we need everyone to recognize the role that we can play in standing up for our kids, fighting back against media addiction, and supporting public servants like you who do such great work. Dr. Vasan, thank you again. Thank you, everybody, for giving us your time tonight. I wanted to share that Mama's very first benefit is happening later this month in New York City. If you are anywhere in the tri-state area, we would absolutely love for you to join us. Information's in the chat. Dr. Vasan, we'd love to have you as our guest there. And if you're not in New York City, you can still support Mama's work. We need your help. So thank you for donating if you can, and thank you all for being here tonight. Dr. Vasan, have a great night. Thank you all.
Thank you to everyone. Thank you, Julie, and have a great night. Thank you.
Take care. Bye-bye.